everyone, so I want to reply to this comment, but also, which is saying, sorry I missed the video explaining, but what's the difference between a PICC line and a Hickman line? First of all, don't worry about the spellings. The PICC line is PICC and Hickman line, you've spelled it right. And someone also asked on another video about the pros and cons of Hickman line and why I'd want a Hickman line over a PICC line. So I wanted to answer this question. Also, any other questions you have, just comment below and I'll always try and answer. Though I'm going away for the next few days, so it might not be for a few days, but I will always try and answer whenever I can. First of all, this is a PICC line here. Also, I've got my little notebook because I did write down notes, but I wanted to make sure that I got it exactly right. And also, this is just me and my personal view and explanation, so if I've got anything wrong, you can let me know. But yeah, it's just me, and I'm just me, so yeah. A PICC line is a peripherally inserted central catheter. Basically, it's a type of central line, and a central line is, we know what you'll have a normal IV in a little vein here, but it's a plastic tube in your arm, but it only is like that long in your vein here or in your hands sometimes that you have in hospital. A central line that goes up to your heart here. So all central lines sit at the top of your heart here, just above the SVC. And you might have seen people in intensive care have lines in their neck or lines in their groin, which I have had as well. As you can see here, there's a line up in my neck here. That is a CVC line, a central venous catheter up in my neck here, which you have mostly in intensive care, or lines in your groin. But obviously that doesn't work for home, and that's where Hickman lines and PICC lines come into it really. A PICC line is the most common kind of first central line that you have. It's a long plastic tube basically that goes up into one of your big veins here in your arm and ends up in a large vein here just above your heart, like I said. One of the differences between a PICC line and a Hickman line, which I will talk about in a minute, is that a PICC line, which always makes not me laugh, it's a PICC line. If you take off the dressing and the secure cap, which is this thing here, a PICC line you can just pull straight out. So when a PICC line needs to come out, you take the dressing off and you can pull it out. Hickman line, you can't do that. Sorry, my brain fog, excuse me if I'm a bit slow with everything. And a PICC line is also good because, well, you have veins on both sides. There's caphilic and basilic, the caphilic and basilic veins. I personally had 14 PICC lines, yes, 14, over the last 8 to 10 years. And both my caphilic veins have gone, they're all scarred and thrombosed, and I've got one basilic which is 2 centimetres and one which is 1 centimetre, and I've got hardly any kind of access left, so they're very, very hard to get in PICC lines. Only one of the top IR interventional radiologist consultants can do it at my hospital. But the difference now about Hickman line is another central line, but it goes in your chest up here rather than threaded all the way up, and it's a tunnelled line. One sec, let me find a picture. This is not the best picture actually. This is actually after an insertion. You can see the two dressings on my chest and my neck. And this is because when a Hickman line is put in, it's a silicone tube, like another tube that's like the same as a PICC line, but it's inserted into one of the large blood vessels in the large blood vessels in your chest. And there's a small cut as like there in your chest. First of all, that's where the entry site where it goes in, and then obviously there's another cut you can see up on your neck, which it then goes up through your neck into your jugular vein, which is your jugular vein up here, was on both sides. And then the tube passes along that large blood vessel and ends in just above your heart, above the SVC, just like where the PICC line ends. And then it comes out through a cut in your chest, so there. And it's stitched into place at first. And the stitches stay in for about 3 to 4 weeks because there's a reason. Because there's a small cuff, which you'll hear people say about a Hickman line, which is around the exit sites where it comes out, there. And this keeps the line in place and stops it falling out. So when the dressing's off, it won't fall out. Unlike a PICC line, you can't just pull it out either, because it's tunnelled. Basically, the tissue under the skin grows around this cuff, and it takes a few weeks, but it grows around it. So when the Hickman line comes out, you have to have surgery under local or general for it to be basically cut out, because the tissue's all grown around it. And that's a big difference between a PICC line and a Hickman line. And a PICC line can stay in for 6 to 8 months. Well, I've had one actually in for over a year or more, but that's kind of the average time. Whereas a Hickman line can stay in for 1, 2, 3, 4. The longest I've heard, it's not a joke, is 20 years. Literally, I was like gobsmacked. But most people's are in for a couple of years. And a good couple of years they can stay, and you don't take them out unless they're not needed anymore, infected or broken. This is a good picture actually from one of my Hickman lines insertion, and it's also purple. It's a power Hickman, which is really good because it can go through CT scanners with the contrast, and it's also a lot stronger. Here it is when the stitches were still stitched in, but yeah, that's it. And then you see the cut above my neck, the 2 cuts there. Hope this is loud on TikTok. yeah, so I hope that explains the Hickman and the PICC line. You can see all my scars here. I also had a portacath, which if you want me to explain, I can explain that. Let me know, I've got pictures and videos of that, which is another central line, but it's properly actually underneath your skin, and so you have to access it with a needle. So yeah, I can go into more of that if you want me to know about that or anything. But you can see a lot of the scars there, and you can see on my arm all the different scars, and on this side as well, all different scars, all those 14 PICC lines. And someone was saying, why do you want a Hickman line over the PICC line when you've got the PICC line in? Well, because like I said, I've had 14 PICC lines, so I have very, very little access left. So if my Hickman line breaks, we want to be able to use my tiny bit of PICC line access left to put an emergency PICC line. And also, unfortunately, quite a while ago, I had an emergency where I needed, it's about a year ago, I needed a central line, and we couldn't get a PICC line in. We went to do my neck, you know, which most people have access to. And I was in theatre and I was awake, and they couldn't get any in, both sides. There was two scar tissue and thrombosed, and that's really bad. It's because I've been in intensive care multiple times. I've been in 4 comas and double figures in intensive care, and we've used my access a lot over the last 10 plus years. And we managed to get a femoral line into my groin, but it was really scary. And he was like, Ruth, you know, you've not got much, nothing left. I couldn't get anything in my neck, and that's really scary. So yeah. And also a Hickman line, I said it can last for years and years as long as it doesn't get affected and broken or fractured or anything. And also because I do everything myself, self-administering, I have extension on these, which is not great because they occlude easily. So my pumps are here, my poles here, the pumps beep easily because they get like positional and everything like that. And the extensions add more infection risk, and they're not great. To do it all yourself. So Hickman line I can self-administer because it's on my chest, and I do all my infusions myself daily. I'm on 7 nights a week TPN and fluids and medicines, all via my central line because I have intestinal failure. So yeah, Hickman line is easier to manage myself and everything. That's one of the main reasons. Yeah, a PICC line is more short to mid-term, whereas Hickman line is long term, and self-administrating, and also like I said, extensions and positional. So yeah, and also yeah, I feel like I'm rambling on and making no sense. I hope I've made some sense, and I hope this has been helpful. Yeah, if you have any questions, let me know. Also, I love these earrings in this video. Like, do you like these earrings? Off topic, because I'm not just all illness and lies, I'm so much more. Anyway, I have to go and do my TPN, talking a bit now. So take me and my sexy pole. Let's go to do my TPN. I hope you're having a great day, and I hope this answered some of your questions. Lots of love. Mwah.